Hi, and welcome to Dr. Brainwaves. I'm Dr. Rena Azar talking about ectopic pregnancy today. Ectopic pregnancy is a pregnancy in the wrong place, and there's a little rudimentary diagram here. It's a uterus with the orange uterine cavity. The ovaries are gray on each side, and you can see that the cavity of the uterus, it goes all the way up here into the tubes and spills out into the abdominal cavity. So when the egg pops out of the ovary in the abdominal cavity, it usually gets fertilized in the tube, travels down to the uterus, and implants and grows. However, in certain circumstances, that egg and its surrounding cells can implant in the wrong place. It can implant in the cervix. It can implant in the cornea, which is right here, which is not really in the proper uterine cavity. It can implant on the ovary. It can implant in the tube and start growing. And the obvious problem is that egg will get bigger and bigger and bigger, quite big. And those other areas are not able to accommodate that growth. So the short of that is that pregnancy, by definition, is a highly vascular state. We get a lot of blood vessels in there trying to grow and help that baby to form and get large. And what happens in an ectopic pregnancy is that it's not going to be a viable pregnancy. It's not going to be a pregnancy that can live. And eventually it will break open potentially and spill a tremendous amount of blood into the abdominal cavity. And if that's not discovered in a timely manner, people can actually die from massive amounts of blood loss related to that. Signs of an ectopic pregnancy can be simply irregular bleeding in the first trimester. Pain on one side or the other, because if the egg is in the tube or in the cornea, which is that little corner of the uterus, that expansion in that tight area will cause an abnormal amount of pain. In addition to that, sometimes people will present only after they've had some internal bleeding. And our abdominal cavity can hold a lot of fluid before we notice it. Sometimes people will pick up on subtle symptoms such as shoulder pain. When there's blood in the abdominal cavity, it will irritate the diaphragm at the top of the abdominal cavity and radiate pain to our right shoulder usually. And so people will come in oftentimes recognizing that pain is abnormal. But other signs of blood loss in the abdominal cavity can be distension, bloating, just a general discomfort. And if your blood loss is significant, your body will start to compensate for that, and your body will start having fast heart rate, low blood pressure, and sometimes you'll get accompanying symptoms such as nausea, vomiting, decreased urine output, things that are suggested that your body's losing a lot of blood in the abdominal cavity. So if you have any of those symptoms, then you need to come in and see your doctor right away. The diagnosis of ectopic pregnancy can be a little tricky. If the pregnancy is very early on, the count of the beta HCG, which is the pregnancy hormone, might be too low and be suggestive that the fetus or the egg is so small now that we can't see it on an ultrasound or a CT scan or any of our imaging techniques. So sometimes you can have an ectopic pregnancy with associated pain and even bleeding, and we can't figure out where that pregnancy is because the actual size of the gestational sac with the baby in it is too small for us to see. However, in anybody who is pregnant, has intra-abdominal fluid on imaging studies, low blood count, or other signs of severe blood loss, oftentimes, if you're in your first trimester, we'll just go ahead and put a laparoscope in and take a look around. That can help us to tell if you have an ectopic pregnancy and where it is. Unfortunately, if it's really, really tiny, we might not see it even with our naked eye once we're inside with a laparoscope. But what we can see is if there's blood coming out of the tube, if there's a mass in the tube of the uterus, and if that mass has broken open and is bleeding. If you have an ectopic pregnancy in the tube, you might either lose your tube, the doctor might opt to take the whole tube out, or your ovary, if the ectopic pregnancy is on the ovary, might lose the ovary if the bleeding is extensive. Sometimes we will salvage those areas. In other words, sometimes we'll try to leave the ovary in and take off just the ectopic pregnancy, or to leave the tube in place, make a little hole in it, suck out that embryo, and then try to allow that to just heal. But that puts you at a little increased risk for another ectopic pregnancy because of the scarring. So that's something that your doctor will have to make a decision about at the time of surgery. If we strongly suspect that you have an ectopic pregnancy, which we might because you have some pain, because your levels of beta HCG are not rising at the normal rate that we would see in a normal pregnancy, and we've followed it long enough to feel comfortable that we know you have an ectopic or abnormal pregnancy in your body somewhere, we may offer you the option of doing methotrexate, which is a chemotherapy agent in certain circumstances that actually decreases the cellular healthiness and causes the embryo to slowly die and dehydrate and dissolve. And that's another way to treat an ectopic pregnancy that's very, very early on. We have very specific criteria that will allow us to consider that as an option for treatment when ectopic pregnancies are discovered early on. Oftentimes, physicians, when they know that somebody's at increased risk for ectopic pregnancy, will follow you closely in your first trimester, even if you don't have abnormal symptoms like abnormal bleeding or pain, and they'll follow your beta HCG levels. We know the rate at which those should rise over time, and that will give us a clue if you have an abnormality in your pregnancy. But ectopic pregnancies are potentially very, very dangerous. And if you have abnormal symptoms in your pregnancy or some of those risk factors that we talked about, history of previous pelvic inflammatory disease or pelvic infections, history of in vitro fertilization, if you had an IUD and when you got pregnant, if you've had previous tubal reanastomosis, which means in English your tubes were put back together after having a tubal ligation, then those are risk factors for ectopic pregnancy. But once again, I've seen many ectopic pregnancies through the years without any risk factors that we are aware of. So abnormalities in the first trimester need to be checked out because that's a potentially dangerous situation. I hope you enjoyed that overview, and thank you for visiting Dr. Brainwaves.